Dear friends, colleagues, today we have a very interesting meeting which was organized by the International Working Group on the role of expert communities in universal health coverage for achieving SDGs. One has to take into consideration that everything that is done in the field today should improve the quality of life, the quality of medical services, the quality of food, the quality of relationships. So this conference today sets the mood for it and unites us around the topic that by harmoniously using the global experience, we can analyze our clinical recommendations for the purposes of healthcare so that we can take into account the achievements of the medical science in our practice. This is highly important. You can just take, 50 years. Over the last 50 years, life expectancy in Europe, in Russia, and the USSR has increased by 20 years, and that is thanks to the medical science. We know that health depends on a number of factors, but working in this area, I can say that the advancements and the achievements we have today in real life, they do indeed help to improve quality of life and to increase life expectancy. So I wish us every success, and we shall start now. I would like to give the floor over to Vladimir Grishin, who is the director of MOS Expertise and a member of the Expert Advisory Board on Public Health and member of the board. Thank you very much. Thank you very much, dear friends. The purpose of sustainable development is universal health coverage. These complicated words is something wrong with the sound? These complicated words actually mean that we have a simple but at the same time a difficult goal ahead to improve the quality of life. You know that there are 17 SDGs and around 200 targets that we need to achieve. But healthcare and all the medical aspects are considered to be the main goals, because without satisfactory level of health, it is impossible to achieve many other of the goals or all of the goals in general. As for the universal health coverage, the United Nations, the WHO, talk about the fact that this goal needs to be achieved through the most efficient means without any financial risks for the humanity. A lot depends on the organization and on the economy of healthcare. In Russia and in the CIS countries with whom we are actively working with through the Interparliamentary Assembly, we are paying a lot of attention to these issues. We need to decide on the model for providing medical aid, which would be most efficient, simple, and convenient for all of us, for organizers, for economists, and for the politicians. The order is not fortuitous because we are trying to protect the health care for our citizens. The second aspect is economy. We are living in a different world today, in a different economy, in a different economic model. Focus is on the development of informational technologies, AI, exchange of databases, etc., etc. So the structure of the economy changes, and the place of a human being in new economic conditions is also changing. So the search for the optimal model for financing of healthcare is a #1 priority for any state. We know that there are several options of looking at this issue. That might be state healthcare paid by the taxes, that's medical and social insurance, personal medical accounts, any kind of out-of-the-pocket services that in a number of states that are underdeveloped is the prevailing form of the provision of medical services. So our team is trying to find ways to resolve these issues, to organize provision of medical aid and to organize its financing. All in all, the project we are discussing today under the aegis of the Russian Academy of Sciences, which is very important, we want to have a systematic and comprehensive discussion of preclinical trials, clinical recommendations, the assessment of technologies in healthcare. You know that healthcare technologies in pharmaceuticals and in medical equipment are diverse and numerous, so that's an important thing to discuss because it affects another issue we're discussing, that is the assessment of health management. And of course, the quality of medical services provided as well. So our team, with the participation of international experts from the former USSR countries, the CIS countries, under the aegis of the Interparliamentary Assembly, and with the participation of experts from Norway, France, the United States, Japan, Australia, and many other countries, we are trying to take a comprehensive look at these issues in order to find the most acceptable and the most economically efficient options for resolving and organizing medical aid provision. So I would like to wish the Russian Academy of Sciences, under the aegis of which we are developing this project, and to our community where we are closely cooperating with many experts from many countries, every success in resolving the very complex issues that would lead them to universal health coverage and achievement of the SDGs. Thank you very much and good luck. Dear colleagues, so we start our conference today, and we have the academician of the Russian Academy of Sciences. He works for the Department of Medical Sciences, the largest department. There are 441 employees at the department. Yuri is also the chairman of the Expert Advisory Board on Public Health of the IPA of the CIS. So I'm give the floor over to Yuri Sherbuk. Thank you very much. Thank you very much, Valery. And good morning, dear colleagues. I am glad that we have this meeting today, and I'm going to present you with information on the role of Expert Advisory Board on Public Health of the Interparliamentary Assembly in universal health coverage in the CIS countries. Our Expert Advisory Board on Public Health is a permanently functioning advisory board created by the IPA in 2013 for the achievement of the SDGs in healthcare of the CIS countries. It was also created to assist the Interparliamentary Assembly in advancing the model law in healthcare, helping maternity and children medicine, the development of medical science, the development of medical and pharmaceutical education, as well as the use of expertise of medicines and medical equipment, the organization of medical insurance, improving way of life and functioning of medical and treatment facilities. The focus of the Expert Advisory Board is to create a law and treaty basis that would regulate the provision of medical aid for the citizens of the CIS and those who are residents of the CIS countries but not citizens. In 2013 to 2015, the Expert Advisory Board carried out a great workload related to regulating treatment and preventive treatment of diabetes. Our working group has prepared projects of interstate cooperation programs on prevention of diabetes and treatment of diabetes from 2016 to 2020 and then from 2021 to 2024. In 2015, at the plenary session of the IPA, the draft recommendations prepared by our advisory board were adopted on streamlining the laws of the CIS countries on healthcare. The purpose of these recommendations to ensure effective functioning of states when it comes to the provision of accessible medical aid within the CIS. The cooperation of the CIS countries when it comes to healthcare, it is ever more so relevant due to globalization, mass migration of population, open borders, and the development of the common economic space within the CIS. In 2016, on the proposal of the Advisory Board at the 45th plenary session of the IPA, we have adopted an important model law on insurance medicine and recommendations on the protection of medical personnel and medical facilities during armed conflicts and other situations of violence. The adoption of these documents helped to develop medical law and the implementation of IHL in national law systems of the CIS countries. In 2017, the Advisory Board helped develop the plans adopted by the Economic Council, these plans of action to implement the health development strategies for the years 2017-2018 and then for the years 2020 to 2021. The Advisory Board recommended that this health strategy for 2022 should include the provision on the preparation of a model law on social advertising and social propaganda of a healthy lifestyle. In 2018, the Advisory Board suggested new areas of cooperation with the Regional Office for Europe of the WHO in order to help spread the program Healthy Cities in the CIS countries. Then our Council has also considered the status and prospects of development of medical tourism, and we have decided to prepare a draft law on the development of medical tourism in the CIS countries. In 2020, we have had a meeting of the Council to coordinate efforts within the CIS to combat the COVID-19 pandemic and our practical recommendations on deployment of temporary coronavirus hospitals in major congress centers are actively being used and implemented when combating pandemic in various regions. In April of 2021, the IPA ruled to adopt the laws prepared by our group to ensure the rights of children for health care and on clinical recommendations when providing medical aid within the CIS countries. Just recently, in October 2021, at the meeting of the board with the participation of major international experts from the US, France and Norway, we have discussed the principles of bioethics, evidence-based medicine and rehabilitation to achieve the SDGs in the CIS member states, and we have reaffirmed the need to actively use the principles of bioethics and expeditious development implementation of clinical recommendations based on evidence-based medicine in clinical practice. The meetings of the expert board are often attended by the representatives of major organizations, the Regional Office for Europe of the WHO, the International Red Cross Committee, the International Federation of the Red Cross and the Red Crescent, UNAIDS, UNESCO, as well as the UN Population Fund. This allows us to fully take into account the main areas for development of international law and to create the conditions for further development of laws in healthcare for the population of the CIS countries. The Advisory Board on Public Health of the IPA continues its activities and is prepared to cooperate with others in order to continue successfully developing healthcare systems of the CIS countries. Thank you very much for your attention. Thank you very much, Yuri. I wish you good health and Happy New Year. To you too, thank you very much. I can see on the screen that we have Belarus with us now. Dear friends, over to you now. Good afternoon, dear colleagues. Valery, good afternoon. I would like to introduce my colleagues who are present here today with me. My name is Alexander Kilchevsky. I'm the Deputy Chairman of the National Academy of Sciences of Belarus. I supervise biology and medicine. Here is my colleague, Nikolai Serdychenko. He's an academician and secretary of the Department of Medical Sciences and corresponding member. Here we have the director of the Institute of Physiology and corresponding member Sergei Gubkin, and the head of the National Coordination Center for Biosafety, Galina Mozgova. I would like to welcome all of you, and our chairman, Mr. Gusakov, could not take part in this meeting, but he recorded a video message. Please turn the video message on so that everybody could see it. Dear participants of the round table, the Sustainable Development Goal is a comprehensive set of humanitarian values which allows us to understand the purposes of building a proper future for humanity. And every community should be provided for in terms of their demands such as food, air, environment, etc. But also they should have good prospects related to the development of science, the integration of best innovations to improve the quality of life. Our present realities test us, with new threats emerging such as the coronavirus pandemic, which has greatly changed the architecture of the world order and require us to amend our actions. The scientific community is greatly involved in that because our mission is not only to provide new knowledge to the population, but to also expeditiously develop responses to challenges. Science is not only a productive force and a driver for economic growth, but it creates the basis for forming a worldview foundation and the ideology of development based on spirituality and harmonious development of people. But now we are faced with stark reality. We are seeing the catastrophic consequences of the coronavirus pandemic, even in the most developed countries in terms of healthcare. And these countries want to isolate themselves and resolve their problem within the framework of their closed borders. So we need to act, and the international community should counter these new emerging threats with their desire to work together, to unite their efforts and exchange information via scientific schools. Our academy is a proponent of expanding and deepening inter-country and interstate cooperation between scientists. We are closely monitoring the situation with the latest scientific trends, and we are exchanging best practices and experience with the leading scientific centers around the world. And historically, Russia is our top priority. It is important that between the scientific communities of Russia and Belarus there are close ties that have developed and expanded due to new areas of cooperation between our countries. We have joint research as well as joint laboratories and cluster forms of cooperation. This is a good response to the coronavirus pandemic. We have managed to hold a series of meetings and consultations. We have prepared a collection of scientific works. I guess you would agree with this is an integral component of the work of a scientist, because we have now obtained this great experience in virusology. We have tested our system of emergency response to new challenges. I would like to highlight that the National Academy of Sciences of Belarus, when it comes to healthcare, is constantly working, and it is a multifaceted work because it resolves all kinds of tasks, from equipping research laboratories in Belarus to the development and production of new innovations and test kits and pharmaceuticals in order to prevent and treat and fight the consequences of various illnesses and diseases. The Academy of Sciences has created an interagency working group on fighting COVID-19. We have the Center of Virusology, which seeks to resolve the tasks related to the security and safety of the country. In future, we are cooperating with the Ministry of Health on all the relevant issues. We are also using such an integrational platform as the International Association of the Academies of Science, under the aegis of which there is a Scientific Council on Virusology. And great productivity within the Council was ensured with the cooperation with Russia. We have learned some very valuable lessons from the pandemic, and the scientific community and the managers should learn from this experience. We need this to have rapid response to any kind of sanitary emergencies, to develop treatment and medicines. Such cooperation is key during the fourth industrial revolution. The great potential of scientists have created a new demand not only for preventive treatment but also for developments in various interdisciplinary areas in technology and innovations, which would help us to become more resilient and to bring about economic growth in the post-pandemic period. The pandemic has also spurred digitalization. We have efficient and flexible ways of communicating and exchanging databases and computer modeling using AI and the organization of network and virtual laboratories. The scientific landscape shows that in the years to come, life sciences would be our top priority, as well as interdisciplinary sciences. There's nano, bio, IT, social and other kinds of technologies. We have developed research in these areas with the leading scientific centers of Russia and other countries. In conclusion of my welcome address, I would like to highlight that in the face of joint threats, national interests should take the back burner, and at the forefront are the interests of development of life and the entire humanity. This requires us to create a common space of trust and be responsible to the generations to come, and to focus on humanitarian values. The scientific communities should lead the way and should guide us when it comes to scientific knowledge in all areas in social and economic life. I'm sure that this meeting that was organized by the Russian Academy of Sciences together with the WHO would allow us not only to exchange our practical experience, but also to develop new promising projects and ways of cooperation. I wish you to be productive and to develop constructive recommendations in order to advance the work in all areas of healthcare. So now it's over to us. Yes? Thank you very much. Thank you very much. So we've heard the welcome address from our chairman, and we are ready to take part in the discussion. And now we give the floor over to our Russian colleagues. Yes, we'll have a discussion later on. Thank you very much. And now Nelly Diveeva, PhD in law and professor of labor law and occupational safety of the St. Petersburg State University, will make her statement. Over to you, Nelly. Good afternoon, dear colleagues. Unfortunately, digitalization is ongoing, but I have now tried, and you see that if I switch on my video, then I'll have no sound. So, if you would allow me, I would like to show you on my screen my presentation so that you could see it. And then I can present you my vision of any issues that we are facing. I'm going to make a report on legal aspects because I'm a PhD in law and I do work a lot with representatives of the medical community. And in this particular case, we are going to talk about the legal aspects of CIS members' states expert communities interaction in universal health coverage. The first thing I would like to point out is that today we need to talk not only about provision of medical aid and medical services, but we need to talk about evidence-based medicine. And the WHO, in its documents, has highlighted this very important aspect that we need to shift towards evidence-based medicine. And then the decisions to use preventive, diagnostic, and other kinds of treatment, those decisions would be made based on their efficiency, safety, and security. And this is the most important aspect of our cooperation within the CIS and the Expert Advisory Board on Public Health of the IPA of the CIS and any other organizations and its partners want to have this approach. Now, as for experts, undoubtedly, we value the experts on international level who implement their programs in other countries. However, it is highly important today to talk about the activities of national experts within the CIS when it comes to evidence-based medicine. Moreover, it is highly important today to cooperate on the inter-country level. It's also important to cooperate on the intrasectoral level. It is one more term that is being used by international organizations. We are talking about the fact that today, even if we have the word medicine, it is not only important to talk about the medical staff, such as physicians and scientific workers, who could move this agenda forward. We are also talking about the need for experts, of multidisciplinary experts, the medical staff and members of professional associations, legal experts and educational organizations in general, such as academies of sciences, the organizers in the sphere of healthcare. Only a comprehensive expert approach could lead us closer to promoting the necessary aspects, so that the expertise would be efficient and the decisions and conclusions would be efficient as well. We need to have a two-sided expert activity. It should be linked to legal aspects, and these are the aspects I'm talking about. We're talking about the analysis of national law and national practice, and the analysis of international laws and best practices. Only between these two areas, the cross point between these two areas, is where we start building an efficient mechanism which would lead us to practically important results. Now moving on to expert activities and to the possible forms of expert activities. Undoubtedly, as we are talking about the CIS platform, we can talk about regional cooperation in this platform. Today we have also talked about that it's important to adopt model laws, and these laws have been adopted, and please pay attention to the fact that today we are preparing some very important laws related to the provision of medical aid and medical insurance, such as the professional law related to the protection of rights of health experts and patients. And health professionals should not be at a disadvantage from the legal point of view, so we should not forget about that. And also one more important model law, the law on provision of medicines, because all the CIS member states have the laws on the circulation and distribution of medicines, but the law on the provision of medicines and the legal mechanisms for providing medicines to all the citizens in need, these kind of legal framework has not yet been developed in many countries of the CIS. Apart from model laws, we also need to talk about one more important result of expert interaction, that is the preparation of methodical recommendations, because evidence-based medicine should be viewed through a multifaceted approach. Such recommendations should be related to preclinical trials, clinical trials, the assessment of healthcare technologies. That is why we need to have a common algorithm. And why is it so important? We are trying to streamline our efforts. We are trying to maximize the best practices. We are trying to use the information that the expert community has. Now, as to one more important aspect where the results of our joint expert work can be used, that is the global international communication and cooperation with the participation of the CIS countries. Top priority document, which is highly important for us, that is the resolution of the United Nations of the 23rd of November 2020, because the resolution talks about the cooperation between the UN and the CIS. This is a very important legal tool, because before the adoption of this resolution, the United Nations and the organizations which are part of the UN, such as WHO and UNESCO, only worked with certain countries. And now the CIS in general is the subject for cooperation for those organizations, which allows us to effectively work on expert level. Please pay attention to the fact that in 2020 our experts have prepared a draft resolution on the integration and cooperation in the development of guiding principles on conducting research in order to advance health care of the population, and the Republic of Uzbekistan has already submitted this draft resolution, and we hope that the Republic of Belarus will join us, because the work is currently ongoing. And perhaps in future Russia will also support this draft resolution, because we need to unite our efforts from the point of view of introducing evidence-based medicine principles, because now it's not only an issue within the CIS, it's a global kind of issue. The cooperation on the global level with the participation of the CIS countries and CIS experts is also closely linked to the activities of UNESCO, because currently, as relevant as ever, is the cooperation between commissions and committees on bioethics in order to resolve the issues which are raised in general in society, that are raised by the coronavirus pandemic, etc., etc. Another important aspect of cooperation between the experts is the national level. We should not try to breach the sovereignty of other countries. That is a very important aspect. But at the same time, we should work together within the framework of the CIS. And when we are talking about national level and the outcomes of expert work, we can say that the top priority area of cooperation. That's the adoption of laws and legal acts in certain countries. As an expert communities, we are not trying to unify and streamline the entire legal system. We are talking about harmonious laws between various countries, considering social and economic processes we observe within the CIS. At the same time, it is highly important to take into consideration national peculiarities and national evidence bases. This is our principal position. We are not talking about a global evidence basis. We are talking about our national research, what every country has, considering climate, economy, geographical and other kinds of circumstances. It is also important to come up with proper results for the executive power to make decisions. It's important that the commissions and committees should function properly, those committees on bioethics on all levels. And why? Because bioethics has not been considered in its narrow sense as a kind of an activity related closely only to biomedical technologies. Currently, bioethics is a broad kind of notion. So, in fact, we are talking about bioethics as a kind of technology of making managerial decisions. And that is why expert community should prove itself to be useful in this area as well. So, as I believe, my dear colleagues, we have all kinds of mechanisms in place, including legal mechanisms for cooperation, and we need to make use of these mechanisms so that the population of our countries would receive qualified and quality medical aid. Thank you very much. Thank you very much for your attention. Thank you very much, Nelly. You see that law experts are now trying to understand what healthcare workers are trying to do, and such a symbiosis between us will help us to streamline and to harmonize the documents we are using in our day-to-day life. Thank you very much, Nelly. And now I would like to give the floor over to Yelena, who represents the executive committee of the CIS, who is going to talk about the main areas of cooperation between the CIS countries in this area. Go ahead, Yelena. Good afternoon, dear colleagues. Good afternoon, dear colleagues. Let me allow to dwell on several aspects of the activities of the Council on general political and social problems of the CIS Executive Committee. The CIS countries voted for the UN resolution to adopt the SDGs, and now, considering the situation we observe during the coronavirus pandemic and the situation in general, such goals are being implemented. But there was one issue. What kind of benchmarks can we analyze when it comes to the SDGs? The Statistical Committee of the CIS countries has accomplished an important task working with CIS countries, and a decision has been made that 17 SDGs would be analyzed according to 111 benchmarks. And now the Statistical Committee of the Executive Committee of the CIS has issued 4 brochures that allow us to compare the pace for achieving the SDGs within the CIS space. Undoubtedly, as part of our Council, we are mostly talking about SDG 3, which covers health issues, and in accordance with the indicators and the benchmarks that we have adopted, you can see the main benchmarks that we are collecting, that we are analyzing, and that we try to focus on in our work. The Statistical Committee, apart from providing analytics, issues brochures where we try to present analytical data in the most informative format possible, and we are also talking about the benchmarks for achieving the SDGs. In 2019, the Statistical Committee and the representatives of the Executive Committee of the CIS countries have taken part in the Global International Conference, where we have analyzed the progress of the SDGs and the indicators and benchmarks when we are talking about their achievements. We are covering the main parameters for the life and activities and health of people, because those are very closely related aspects. We're talking about social, economic, environmental aspects when we're talking about population and when we're talking about health. This directly affects the level of life and health of the population. As I've mentioned, the Health Council of the CIS, which includes health ministers and sanitary experts, focuses primarily on SDG number 3, that is a healthy lifestyle and welfare for all, regardless of their age. In this regard, the Council has defined the basic areas of work, and the foundation for such work are the treaties and agreements as part of the CIS. Another basic element is the implementation of decisions, collegiate decisions, made by the Council of Foreign Ministers, the governments, the states, and of course the heads of states. Currently, as part of the CIS, there are 6 expert groups that work on developing new international agreements regarding healthcare. Since 2019, we have started to use a new area of cooperation. Those are basic organizations, and over 2 years, as part of the Council, we have established 4 basic organizations in 4 areas: oncology, psychiatry, narcology, and healthcare. And this year, we have established a new organization that is cooperation when it comes to emergency response and sanitary epidemiological emergencies. We have also created 9 commissions in various areas, working groups, and undoubtedly the Council is implementing its practical purpose not only at the meetings, but also we have conferences, outreach programs, and exercises. As I've already mentioned, SDG 3 is our key goal, and annually we try to analyze the benchmarks on whether this SDG has been achieved or not. One of the main points here is to analyze the situation on HIV, on TB, on child mortality, on drug addiction, and psychiatry. As for HIV, we are cooperating within the framework of the international agreement, and the member states have also adopted the TB action plan, which has defined the main measures we are going to undertake and the main goals we're seeking to achieve when fighting TB. I would like to highlight that within the CIS, we annually invite the representatives of international community to discuss the achievement of the SDGs. In 2021, this conference took place in not in an online but in an offline format in April.
В настоящее время в рамках реализации целей устойчивого развития
as part of
мы
the
определили
implementation
для
of the
себя
Sustainable
4
Development Goals, we
приоритета.
have
Это,
earmarked 4
безусловно,
priorities.
новый формат нашего взаимодействия в период пандемии
It's a new format for
COVID-19.
our
Это
cooperation in the context
взаимодействие
of this
по
pandemic
санитарной охране
and its
территории и
interaction
санитарно-эпидемиологическому
on
благополучию.
sanitary and
Это
epidemiological
взаимодействие
well-being,
в
and
борьбе с
third is
неинфекционными заболеваниями.
interacting with
И
non-contagious diseases.
относительно санитарно-эпидемиологического
As far as
благополучия
the
вы
sanitary
можете на
and
экране
epidemiological
видеть
well-being
большой
is
пакет
concerned, you
документов,
can look at
который
the screen and you can
формировался и
see a
формируется
huge
в
set of
настоящее время,
documents
начиная с
which is still in progress
1992 года.
and is under
Хочу отметить,
development.
что в
We've been working on it
2021
since
году на
1992,
базе
and
одного из
in
наших институтов, на базе
2021,
базовой
thanks to one of
организации, создан сотрудничающий центр с Европейским
institutions, one
региональным
of our
бюро
centers
ВОЗ
cooperating
по
with the
предупреждению
European
ликвидации
Bureau for
чрезвычайных ситуаций в
WHO
области
on
санитарно-эпидемиологического
emergencies.
благополучия.
We have covered this
Что
topic.
касается борьбы с неинфекционными
And as far as
заболеваниями,
non-infectious diseases are
здесь у
concerned,
нас самый наибольший аспект взаимодействия.
we have
И мы идем по направлению
this as the greatest area for our cooperation, and
и профилактики
we
сахарного
cooperate
диабета,
in fight against and prevention
онкологическим
of
заболеваниям,
diabetes,
борьбе с
cancer,
туберкулезом,
TB,
табакокурением. В
smoking,
настоящее время
and
у нас, как я сказала, действует 9
presently, as I
комиссий,
mentioned, we have
которые
9
охватывают все
commissions
эти аспекты. Также
which
одним из
are working on
очень
daily
важных,
basis and covering all this
хотя
aspect.
отмечу, достаточно трудоемким, является работа комиссии по лекарственным
The Commission
средствам
on
лекарственного обеспечения
Pharmaceuticals
государств
and
участников СНГ.
pharmaceutical
В
provision
этом году
is
мы взяли
conducting
на
a
себя
huge
несколько
workload.
новых направлений.
And this year
Мы
we undertook
разрабатываем
certain new areas of work. We are working on
плана
a
и вопросы
draft project
лекарственного
and
обеспечения и
issues of
антимикробной
pharmaceuticals and
Также в
fighting
этом году мы приступили к обсуждению вопросов по
microbial
информатизации
resistance.
и электронному здравоохранению в государствах, участниках Содружества.
Work on digitalization and spread of information
Одним
within the
из
CIS.
важных и
One of
перспективных
the
взаимодействий
most important areas of our cooperation is our international cooperation. At the moment, our Council for Health Services Cooperation interacts with the Interparliamentary Assembly, and Yuri has already mentioned in his presentation the results of our joint efforts, and of course, we cooperate with WHO, with UNAIDS, and this year we have actively cooperated with UNCTAD, and Eurasian Economic Union is another long-term partner that we have, and of course Executive Commission has been mentioned, sees the UN platform as a link which brings the entire world together, and we actively use its possibilities and capacities in order not to just depend on our own capacities and efforts, but also rely on the expertise and the highest expert level, professional level of the entire world. So, dear colleagues, we're going forward, and it's really nice to be going hand in hand, and I thank you very much for the invitation and the opportunity to present here. Thank you very much. Thank you very much, Елена. We have received great information about this social sphere, about the Executive Commission of this union, so we're not starting from scratch. We're developing something which has been already constructed over the last 30 years. I thank you very much and wish you good health and wish you good new year. And now we would invite Alexander Mohov, head of the Department of Medical Law, our legal expert, to tell about the interdisciplinary expert approach to sustainable development. I think he'll talk about sustainable development of the society. Dear colleagues, I hope you can hear me, and I hope you can see my presentation. It would be much better if you could see the pictures, the visual aids. So we are working on the images.
on their sharing. And I would just like to say a few words, given that we are limited in time, to say a few words about sustainable development in the context of ensuring biological and other kinds of security. Today it has been mentioned that we have been talking about sustainable development, and as a reminder we can say that sustainable development is an ideal situation, an ideal model, a perfect image when in a certain way we combine economical and social, cultural processes and at the same time satisfy the basic needs of the human being. And that's how we come to sustainable development. What does it mean for us? First and foremost, in the context of medical services, health care, we would be talking about accessibility of medical services and then quality of medical services provided. We are resolving these issues and moving towards the path towards sustainable development, and problems surge, they accumulate, and at the moment in the Russian Federation, according to official data, about 20%, and according to expert evaluations, up to 40 or 50%, the sector of paid medical services is that the share in the entire mix, and that's a very dangerous situation. So if we're talking about sustainable development, we're trying to serve the issue of affordability and accessibility of medical care as soon as possible, and then take care of the quality of the services. Another aspect is maintaining reasonable limitations. This concerns consumerism and consumption generally, and consumption in healthcare and medical services. The same thing we can see certain trends when some directions of work, some areas or services die off, or maybe medical services provided at someone's desire, and this often hurts the overall system, because we see that there is an outflow of gynecologists and other specialists into other spheres, and we see lack of specialists in the main sector. We have to understand where we are going, what are we developing, and which needs we are satisfying as priorities, which we are satisfying as we can, and which from the point of general health care we are not satisfying, but which are satisfied by the private sector as far as it can be provided for. Another issue is maintaining the environment. It's mainly biological and environmental aspects. And here there is lots to be done in terms of maintaining biodiversity and creating, maintaining bioresources centers, as well as establishing new spheres of work, which would enable us to have a positive outlook on the future. Another aspect is taking into consideration not just the present-day generation's interest, but also the upcoming generation. Unfortunately, from the point of strategic documents and planning, this important aspect is being lost out of sight, because sometimes we forget about the health and future of the upcoming generations. And if we talk about the practicality, we should be talking about the evaluation of the technologies used in medicine, in agriculture, in food systems and other related systems and technologies. And this brings us to the issue of biosecurity. And I would also like to remind you about the well-known Maslow's pyramid, and we see that the issues related to life and health of our citizens, with ensuring biological and other kinds of security, are basic needs. If we do not satisfy them today, we will not be able to move up towards the path of sustainable development, and so this corresponds to the interests of the state and its interest in medicine, pharmaceuticals, medical equipment, etc., and other issues which I will mention today later on. And when we talk about sustainable development, we should also say
A few words about biosecurity, which is widely discussed today, but unfortunately not always do we understand what biosecurity is. At the end of 2020, we passed a law on biosecurity. It's a step forward. It's an important step, but from our point of view, this law is framework, it's fragmented, and it's not tied to other kinds of security. And for example, COVID pandemic demonstrated that problems and breaches in biosecurity directly influence economic security and social security and all other kinds of security. And proceeding the idea today, when we talk about biosecurity, we have to understand it in a broader sense. And in particular, when we talk about ensuring biosecurity, today, as far as I think, we have to talk about speeding up development of medical services, technologies, and healthcare coverage, which should include not just vaccination. It's important, but not enough. And supply of pharmaceutical, both for treatment and for diagnostics, and using new technologies in management, in IT, which would enable us to effectively resolve with minimal costs to economy, social sphere, the problems which we are facing today. Because, for example, we have vaccines today, but we also see the different difficulties emerging in the context of vaccination. So this requires ensuring biosecurity, informational security, and other kinds of security. Another important issue is strengthening the universal healthcare system. And right now we are at the crossroads. We have to understand what kind of system we're going to have today, or the day after, and tomorrow, and the day after tomorrow, and how we would ensure such security, and how should we foster the health of our citizens. As it is directly stated in one of our president's decrees, it's now a factor of national security. So the question is where we developing prevention or treatment would decide many things in the future, and we have to settle these issues now. And of course it's hard to decide on this without a legal framework, and not just a national legal framework, but also international framework. And we should develop the aspect of international law in this sphere, because the COVID pandemic demonstrated that international legal framework, sanitary regulations and rules didn't work. And every state at the end of the day was isolated at the first stages and tried to resolve all the issues on its own. And we saw that it wasn't very efficient for the most part. That's why we have to establish a modern system of biosecurity at national level, regional level, and maybe even as a separate function on the international level. So what do we need for this? I do not know if they can move on to the next slide, but first, it's the shift in paradigm of the security, biosecurity in our country. What do we understand under biosecurity in our law is a very narrow definition, and from the point of healthcare, it's not just a set of infectious agents and factors as threats, but also other diseases, socially important diseases, because without resolving this, we will not resolve our demographical issues and would not be able to introduce health-improving technologies. And as I mentioned, we have to study biosecurity in the context of other security systems, and of course bio-threats should be understood in a broader sense today and should be studied in the context of other threats and risks,
we understood this just recently. It's the same technology, even medical technology or healthcare technology, can be used for the good and for the evil. So we should use all the set of tools at our disposal, scientific, industrial, all the way to legal and ethical frameworks. And solving these issues, in my opinion, requires a broader understanding of the challenge and aiming for larger national and regional projects. First and foremost, it's a project on biosecurity. If we do not resolve these issues, we will not be able to achieve sustainable development. And we should also develop a project on biomedicine. A biomedical project would enable us to resolve our medical objectives in pharmaceuticals, in medical products, etc. And this progress gives us a basis for coming closer to sustainable development in a whole set of sectors of economy, from the ones we're used to and all the way to agriculture and green technology. But in order to move on to solving these issues, I hope you can swap the slides. What do we need to do today? What decisions should we make today as proposals which we hear? First, we have to establish a groundwork for implementing this project. Please move up to the next slide. What do I mean by the foundation, the nucleus of it? We should concentrate our efforts in science, in innovative entrepreneurship, in order to ensure biosecurity and other kinds of security. How can this be done? Some used the path of cluster development, some established specialized centers, technological platforms, but the idea is clear that we need to concentrate efforts and bring them together for the implementation of a large project. Now, from the point of law, we need special regulations, special frameworks, and this will allow the project to work based on special conditions provided with subsidies, stimuli, etc. And then, as we develop this sphere, we should change the legislation concerning science and scientific activity, and also in healthcare, and legislation on biosecurity. And, of course, it's impossible to talk about sustainable development without developing the evaluation of expertise and technological development. And this includes social and humanitarian evaluation and evaluation from the point of biosecurity and other kinds of security. And in its turn, this raises the issue of development of bioethical field, because even biosecurity today demonstrates that breaches in ethics raises the issue of reliability of evidence database and prevents us from implementing our project. And all of these new institutions, all of these elements should be introduced into our legislation. For the moment, we are not seeing it, and we just see some isolated legal instruments, which is insufficient. So from the point of view of biosecurity, there is lots to be done, institutional and legal, on national and regional level. Thank you for your attention. I thank you very much, Alexander. I thank you very much for providing grounds for our further discussion. And Tamara is a member of our Permanent Commission on Environment. Since we mentioned environmentalism, we would invite to cover this from the point of view of parliamentary activity of the Republic of Belarus. Please, Tamara, the floor is yours.
Добрый день. Слышно меня? Добрый день.
Пожалуйста, продолжайте.
Уважаемые коллеги, позвольте высказать слова благодарности организаторам мероприятия за предоставленную возможность
the organizers of the event to participate in the work and discuss pressing issues related to the role of expert communities in the health coverage in order to achieve sustainable development goals. Our joint work is aimed at achieving the most important goal, which is to ensure people's health for the whole life of this or that person, which is enshrined in the Sustainable Development Goals adopted at the highest level in 2015. In order to achieve this goal, we need to create a special healthcare system which brings together all global, regional and local intergovernmental mechanisms, as well as expert medical, patient and business communities. The Republic of Belarus has actively participated in developing the agenda in the sphere of sustainable development till 2030 at all the stages. And beyond debate, we have assumed responsibility to achieve SDGs aimed at bringing up the standards of life. In order to take into account the national realities and priorities related to fulfilling 2030 Agenda for Sustainable Development, Belarus established the national coordinator, which is in charge of SDG achievement in 2017, and there has been some regional groups established in order to fulfill the goal 3, which covers providing healthcare facilities to all people and ensuring demographic security till 2025, has been prepared on the basis of the main provisions of the National Strategic Development of Belarus till 2025, as well as program documents of the relevant development. The country has established the system of coordination and control over the implementation of these goals on the ground. We have established a broad network of systems and facilities that provides inpatient and outpatient facilities and services. The Republic has the personnel needed, and the system is in place in all the regions and cities. There are infectious facilities. Belarus has contributed to achieving SDGs, and it is stipulated by Belarus' highest level of development and high ratings. And Belarus has assumed its role in terms of development of the human potential, and it ranks 53rd when it comes to the index of human development. The country has established an effective and viable mechanism to achieve SDGs, the national architecture of development, and it envisages the parliamentary group within the National Assembly, which brings together the House of Representatives, and it assesses how these projects affect the sustainable development and parliamentary control in this area. It is important to point out that for the first time in December 2017, Minsk hosted open parliamentary debates on the partnership of different branches of power for achieving sustainable development goals. We all understand very well that the foundation of any state policy aimed at bringing up the standards of life is actually the normative basis, and by coming up with new laws and legislation, the government builds national and global and regional development goals. And Belarusian parliamentaries have contributed to achieve sustainable development goals. And I can mention some examples. I'm talking about laws addressed and debated in the Parliament in November 2020, a law of the Republic of Belarus on amendments to healthcare system and providing mental health was adopted and entered into force in May 2021. And right now, the House of Representatives is considering the draft law on the rights of disabled persons and their social integration. It's one of the steps to implement the norms of Convention on the Rights of Disabled People that Belarus ratified in 2016 by assuming the responsibility for creating special conditions and putting them on equal footing with everyone. And now Belarusian Parliament is building the normative basis in order to achieve sustainable development goals. Distinguished participants, all the 17 goals, including the third one that we have been talking about, are universal, but it is impossible to take a go-it-alone approach. It is important to ensure everyone's participation in this work, and for this reason, we should facilitate the partnership between states, parliaments, civil societies, all the branches of power, and business communities. We should ensure neighborly relations based on mutual respect and support. Belarus is open for open cooperation with all the parties concerned in the interest of a stable and prosperous and healthy world. Thank you for your attention. Thank you very much, Tamara. That is a good overview of what is being done for the people of Belarus. And now we are going to give the floor to Chukhanov Alexei Nikolaevich. So please, you have the floor.
Уважаемые коллеги,
distinguished colleagues,
меня слышно?
Can you hear me? Yes, we can hear you loud and clear. Great, thank you.
Мы слушаем вас.
Да. Уважаемые коллеги, я приветствую вас всех, благодарю за такое приглашение,
участие в этом форуме, который
наверное, является не таким частым мероприятием. Это
This is not quite a frequent event, an opportunity to exchange views and assessments. I would like to say a few words about providing medical care through medical education. So we are moving from education to practical activities. The education system is a combination of components and elements aimed at providing professional competences to specialists and right approaches to fulfill professional activities and objectives. As of today, we are providing higher education in 8 areas, and we are training the professionals of the highest qualification and vocational training. And this is actually our main task, since we are the institution of postgraduate education. We have a system that has been functioning actively, and we have been adopting state policies based on such principles as continuous education, state regulation, taking into account the needs of society and the state, and individualization of medical education. I mean that a student can choose forms and methods of training and education. Digitalization of the educational process, bringing together practice and theory. And we have been integrating into the global educational space, trying to preserve the best practices of the national system. There is continuity between the levels of medical education, I mean higher education and postgraduate education. When it comes to healthcare system and education healthcare system, we have been providing higher education in special institutions. I know that Russia has also preserved the model of training postgraduate experts in the form of universities, including the Academy of Continuous Education for Adults. Our academy looks similar. The only thing which is different is that Belarusian Medical Academy of Postgraduate Education is the main university, and other 4 universities have opened postgraduate education departments where one can receive advanced training. This contributes to higher competences, better competences that students and postgraduates get. The system allows us to provide training in additional 15 medical facilities. These are relevant 15 medical centers. You may know them, like cardiology, radiology, and many others. So there are 12 relevant medical facilities that provide advanced training in quite narrow fields. And we have been providing training as well in other 3 facilities. In the surgical center, the clinical medical center, under the administration of the President of Belarus, and the practical center of hygiene. All these opportunities are provided to the experts with an aim of providing better education in quite a narrow field with most qualified doctors and specialists, training them. They are well climbed both in Belarus and abroad. Our academy is a leading institution of providing postgraduate education. And students should take advanced training courses of about 100 or 150 hours, and doctors have to take these courses during their career. As for postgraduate education, there are courses like advanced training courses, internships, which take 2 or 3 days, and they are about most relevant fields, and internships, and postgraduate education and graduate education. We have about 18,000 students a year. 17,000 take advanced training courses, and 1,000 of them do the reskilling. When a student graduates, he can take or she can take postgraduate courses and internships which last 12 months, and after that he or she will be given a certificate which allows him or her to take a career as a doctor. I should say that in the era of epidemiological turmoil, we should create conditions for doctors conducive
без возможности обучения.
For training. So we have been using internet technologies quite broadly, and the COVID-19 pandemic has triggered the development of digital technologies in the form of webinars, workshops, conferences, fora, and we have involved experts from far abroad and our neighbors as well, including Russia, and we have prepared a number of courses, 500 courses in different areas, including the ones devoted to COVID-19. Apart from that, in order to provide better conditions for experts to work, including doctors working with COVID-19 patients, we have conducted webinars to improve the knowledge and competences of doctors working in higher education institutions and medical facilities. And doctors have also taken courses to overcome stress and pressure. I'm talking about doctors treating COVID-19 patients, especially when we're talking about fatal cases. And over 2021, 500 people have taken the course, which shows how important this course is to build the necessary behavioral model. We have also distance courses and online training provided to postgraduate students, including the radiological diagnostics of COVID-19. And for epidemiologists, we have courses as well, and we update them very often on diagnostics, treatment, and prophylaxis, preventive treatment. We have analyzed the materials that we have. We do that once a week. And we have been updating this block of studies. Then there is another important problem. It's respiratory diseases caused by COVID-19. And this is very relevant as well. And another block is devoted to actions taken by MS paramedics. We have made a breakthrough in training doctors and paramedics, and it's opening the Republican Center on the basis of our academy. It will provide 9 virtual hospitals. This is a simulation center that will be well equipped, and although we are opening it quite late, it's one of the drawbacks of the model that we used to have, but still it have let us to get best simulators. I can tell you that simulators become obsolete very fast, and having bought them under the contract, we understand that there is something new in the market already. So if it's okay, we will be able to open this Republican Simulation Center in March, and it will become a new landmark in the development of the practical component of training. And this is a long-awaited opening of the training facility, indeed. High-quality education is provided by professors. This is our golden fund. We have 2 corresponding members of the Academy of Sciences and 5 members of the Academy of Science of Belarus. And the average age of professors is about 40-50. And about 45% of professors have degrees. And this allows us to say that we have managed to preserve the backbone of best professors, which can provide a good education and high-quality knowledge to our students.
As a kind of a confirmation for our scientific potential and our staff potential, I can give you an example that annually we receive presidential grants as a kind of a special assessment of the work they have accomplished for medical services. Our academy also has 20 pedagogical and scientific schools that work in very relevant areas. This allows us to talk about the leading role of our university as a key facility for diagnostics and research. We are one of the leading institutions in great part due to the schools that I have mentioned. Ensuring quality education would be impossible without broad cooperation with various international institutions. In particular, we have 73 international agreements on cooperation and joint work in education with our neighbors and other countries, with the Russian Academy of Continuous Education, with the St. Petersburg Medical University, the Pavlov University, the Northern Medical Universities, and many other universities in Russia. Thanks to such opportunities and cooperation and the very friendly relations we have with our partners, we have managed to revitalize our educational programs and introduction into the programs of all kinds of innovations that we are seeing emerge today. We are a practice-oriented institution, and as such, we focus on introducing all innovations into practice through education. I would like to share my joy that just yesterday we had a hallmark event. We opened one of the offices that undoubtedly will become a major event of the year 2021, because this office would allow us to join the process of developing clinical recommendations on the most relevant issues, such as diabetes, for example, and on many other issues as well. So I'm extremely grateful to all the facilities and institutions that help us develop these areas in Russia and in Azerbaijan, in Uzbekistan, and in other countries. I have to mention that by giving its due to the need to keep the postgraduate education system of the Soviet Union, in order to keep that, we helped to co-organize the Eurasian Forum with the CIS countries that was dedicated to postgraduate education and the prospects of postgraduate education. Delegations of leading postgraduate institutions took part in this conference. In particular, Dmitry Sychov was present, who represented the Russian Medical Academy of Continuous Professional Education of the Ministry of Healthcare, the Kazan Medical Academy, and other medical institutions. And at the collegiate meeting on the 13th and 14th of December, which took place in Moscow with the participation of the Ministry of Healthcare of Russia and the Ministry of Healthcare of Belarus, we found support from Dmitry Pinevich, the Minister of Healthcare, and Mikhail Murashko, the Minister of Healthcare of Russia, that they helped us to make the decision to hold the second forum, the second Eurasian Forum, to discuss all the issues that are outstanding, because the graduate and postgraduate education, those are different types of education. We need different approaches. We need to take into account all the nuances. So the distinguished ministers of healthcare have approved our idea of holding such forums on a regular basis. I'd like to mention that the practical skills and the theoretical knowledge that our students receive at the university are being used at clinical basis of our facilities, where professors and teachers carry out their research work. I have to say that we have a number of such bases in place, and around 120 facilities in Minsk actually function as our clinical bases. Another innovation this year, that's the advancement of professional assessment of medical workers in accordance with the new healthcare law, which was recently adopted in Belarus. I have to mention that the law was greatly amended. For example, second qualification category is now obligatory, and the number of demands for meeting the criteria of the first category has also changed. That is probably due to the changing times. Everyone knows that the first category workers should be far ahead of those in possession of the second or third category. So, as criteria, we have introduced the need to have publications and to give speeches at congresses and conferences. Due to limited time, well, I can dwell on about the ensuring quality of medical aid for a long time through education, but I have mentioned the main points. Thank you once again for providing me this opportunity. I'm glad to see you all and to take part in such an distinguished meeting. Thank you very much. Thank you very much, Alexei. We have heard about continuous education throughout your entire life. And Sergei Cherkasov is going to make another very interesting presentation. Thank you very much, Mr. Chair, dear colleagues. Thank you very much for the opportunity for presenting the information on my topic. When we are talking about public healthcare management for achieving SDGs, we are not only talking about statistical indicators, we are not only talking about describing the general healthcare situation, but we are also talking about finding the proper levers for the situation to develop in the way we want it to develop. If we do not have full information, as was mentioned today by Mr. Chair, it's if a blind person is trying to determine what animal is before them. So they have only limited information but cannot see the whole picture. When we are talking about informational support, we can say that this is the cornerstone or the foundation of the building, so to say, that provides for achievement of our goals. We need to talk about various classifications as the basis for information management. Then we can talk about resources, the possible use of resources, the assessment of the public healthcare sector. And then we see the kind of the public health situation that we want to have in our country. So what is the current situation like? I would like to talk about 3 points: that the information data on public health care is not enough and the quality of data is unsatisfactory. When we're talking about international research, international comparison, and international cooperation, we can see that the data on public health care, on the quality of medical aid, diverges in a lot of ways. We can remember the parable about the Babylon Tower, when everybody started speaking different languages, and that's why the construction was not completed. We have very tangible goals, but due to the fact that we are speaking different languages, so to say, we do not see any satisfactory results. And using international classifications allows us to form this single language, this single system is fragmentary. So why have I decided that it is so? You can see on the screen all the international classifications which has been developed up to date. They do not cover all the goals that we need to achieve, but at least in the sense that they have been developed. So what are we using in the public healthcare sector? We only use the basic diseases classification. We do not use any other classification which provide for a more detailed description of any kind of medical conditions in oncology, for example. Well, in oncology, we use the MKBO, which is fragmentary. When we're talking about cardiovascular diseases, for example, we do not use any such classification. So what is the result? In the international classification of diseases, we only give a name to a disease. So we have this binary principle, whether you have the disease or not. But we understand that there are various types of diabetes, for example. So we need to understand the degree of the disease, the status of the disease. And when we're talking about any medical intervention, we call not about curing diabetes, but we are talking about treatment, so that a person with diabetes could live a proper life. We're describing this, we're not taking it into account. This is not something that we can do. When we talk about medical interventions, we are talking about different things. When we're talking about education, when we're talking about operations, we can actually mean different things. So we need a single qualification that would allow us to properly describe the medical intervention at stake. So what am I talking about and what am I suggesting? The expert community needs to use all the types of classification that has been developed by the international community on medical intervention, on diseases, on illnesses, on medical conditions, etc., etc. And we also need to develop additional classifications which would provide for more detailed descriptions for specific medical conditions. That would allow us to achieve a great mass of data that we need to analyze using digital platforms, because we need to keep up with the time. And we would have a kind of an educational space that would allow us to train our experts so that they would understand each other, first and foremost, and would have detailed discussions of the issues that they need to resolve. So what are the prospects? When I talked about additional classifications, I meant that we need to create instruments that would allow us to receive and analyze data, real-time data, and to respond proactively to the risks of public health. We are currently not undertaking steps that would allow us to prevent any kind of negative scenarios. And another point that is important is to integrate these tools into decision-making mechanisms on all stages, starting from the primary healthcare and ending with the Minister of Healthcare. We have a great goal ahead of us, and expert community might find their own path towards it, but we have the similar goal, because the goals for us have been set. I believe that if we would unite our efforts as part of expert cooperation, we would achieve those goals sooner, because we will walk the same road, we will help each other out, we will share our achievements for the benefit of all. Thank you very much. Thank you very much. I'm sorry, I was not talking into the microphone. Thank you very much, Alexei. And now, speaking of integration and trying to understand each other, you know, since the 20th century, we have seen the emergence of new technologies. Back in the 60s, we had a lot of public disciplines. And then they told us that logic and philosophy developing helped us to advance our society. And I guess this is what you are talking about today. We are technologically advanced, but how can we integrate those advancements into our life? That's an issue that we will need to resolve. Now I would like to ask our colleagues from Belarus. We are actually ending our conference or our workshop. Perhaps they have some opinions, some views on how we can move forward. Over to you. Dear colleagues, am I online? Yes. So I would like to give the floor over to my colleague, Nikolai Serdychenko. He has a short presentation he would like to make. Yes, please. Colleagues, friends, it's clear that the SDGs, when it comes to health, those are first and foremost investment into healthcare, into preventive measures and lowering behavioral risks. The relevance of today's event is that we can, in a bilateral format with our Russian colleagues, to deepen our cooperation when it comes to achieving the SDGs. It is with the Russian scientists that we have many years of positive experience of cooperation in all scientific areas, and a lot has been done as part of the CIS programs and joint competitions for the Basic Research Fund and through our academies of scientists. This has allowed us to broaden our cooperation and to revitalize our cooperation based on our mutual interests. In these conditions, it's important not only to break those ties, but also to strengthen those ties and expand our cooperation between our scientific communities. I would like to dwell on the speeches that we heard, that the achievement of SDGs is not possible without the optimal use of financial resources. This particular area was not mentioned. Only Alexander talked about it in his presentation when he talked about economy, but medical econometry and all the issues related to it should be discussed with legal issues, and perhaps the economic issues are even more important than legal issues. The medical workers should understand how they can allocate the resources they have at hand. so as to achieve the result that we seek to achieve. This medical economy, medical econometry issue is very important. We should not forget it on par with legal issues. Thank you very much. Thank you very much. Please, the Republic of Belarus, any more opinions that you have? In conclusion, I would like to congratulate you on the new year and Merry Christmas to you, all the best to you. I was glad to see you in person to talk about our cooperation. I hope that soon we will be able to form a joint program on virusology. We are preparing such a program. We are looking for partners, and I hope that all our plans will come to fruition. Thank you. So we met in May, but since May we have greatly advanced our joint work. So good luck to us. And today we have a very important day, the 21st of December. So now talking about time, there's this changing time factor, daytime factor. I would like to ask Sergei, who opened a new office yesterday when he talked about this major work. Sergei, please go ahead. Over to you. Dear colleagues, I would like to keep it brief.
Yesterday was a very important day. We opened the office of the Eastern European Coordination Center for Eurasian Cooperation in medicine and public healthcare. It's public-private partnership which has grown and relies on the Expert Council in Healthcare under the Interparliamentary Assembly of the CIS states, which has been mentioned by the chairman of the committee, Mr. Sherbuk, and we work in partnership with our experts, with our scientific authorities, Russian Academy of Sciences, and with the Ministry of Healthcare of the Republic of Belarus, as well as our closest partners, the Belarusian Medical Academy of Postgraduate Education. And yesterday we inaugurated our Office of Cooperation in the fields which were mentioned by Vladimir Grishin in his welcome address, and specifically clinical studies, systemic analysis, clinical recommendations, evaluation of healthcare technologies, and evaluation of healthcare administration, and evaluation of quality of medical treatment. Yesterday, we tried to formulate our primary goals, but I would like to mention that yesterday's event, which took place at Belmapo, brought certain results because from 1st to 3rd December last year, under the decree of the Health Ministry of Belarus, we organized a conference where we launched our cooperation not just on the territory of Belarus, but also in other CIS countries. And I would like to mention that two issues which were covered in practical aspects yesterday, and the work that was launched yesterday included first further development of prevention, diagnostics, treatment and rehabilitation of diabetes patients. And I would like to say that this program was developed by us over a number of years, and with the participation of national experts of the CIS countries and international experts. And we produced this
program in synchronization with an upcoming program of the Committee of the CIS, and at the next Expert Council, I mean the Expert Council on Healthcare under the Interparliamentary Assembly, which will be on 30th of March, we will try to specialize and utilize our work from the point of view of expert component of our joint diabetes programs. This work, this program is headed by a professor, Doctor of Medical Sciences, head of the Department of Endocrinology of the Belarusian Academy of Postgraduate Education, and head of the Association of Endocrinologists, Larisa Danilova. And another aspect which we discussed yesterday, and which we are moving up to the practical stage, is launch of investigation of pharmaceutical sufficiency against COVID-19, taking into account pharmaceutical, economic, marketing studies and evaluation from the point of healthcare technologies. And I invite you to actively cooperate on this project. And Valery, we have come to an agreement with the management of Belmapo that during the upcoming month we will structurize our action plan of our Eastern European offices, and we will present it to you for approval and to the Belarusian side for approval. And our next plan is to launch our new office, our new headquarters, our Central Asian office in Tashkent, and that would be the end of my brief remark, and I hope that
Глубоко уважаемые коллеги, Владимир Иванович Стародубов, академик секретарь нашего отделения, сейчас на президиуме Российской академии наук, и поэтому передает
one of our academicians is at the Russian Academy of Sciences, and he wishes all the best to us and all of the colleagues on this forum and this sphere of work. Understand correctly that today the expert role of the society is of utmost importance. In the Russian Federation, at the moment, not a single decree is not adopted without public discussion, and Russian Academy of Sciences is an expert body. And through our branch, a lot of work has come this year in terms of applications and other reports on medical topics. Somewhat about 14,000 decisions were made by us, and this practice of expert evaluations already exists in Russia, and this International Assembly, Interparliamentary Assembly, as a platform for such expert discussion, platforms for searching for solutions is extremely important. Thanks to such solutions, we use information from all over the world, and I hope that the organization represented by Sergei will serve this good cause. I wish everyone Happy New Year and good health, and thank you for a great conference.